lift refers to basically a circumferential excision of skin from front to back around basically the belt distribution on someone. It can also refer to other body procedures like a thigh lift, which is often combined with a body lift, and that can either be the medial thigh or the outer thigh. Body lifts are often performed on patients who have lost significant weight rapidly, massive weight loss patients. In this patient population, because the weight loss is so rapid, the elastic properties of the tissues don't rebound, and they're left with significant laxity that cannot be corrected with exercise or dieting. In fact, losing more weight might make it worse. Really, the only efficient treatment is to remove the skin. And it's removed generally anywhere there's laxity. That could be anywhere from the arm, which is a brachioplasty, and that's a different topic we'll talk about, or the thigh, or again, the back and abdomen. Thigh lift can either be the outer thigh or the inner thigh. The outer thigh lift will tighten skin, obviously on the outer portion of the thigh, but is often combined with the body lift generally to tighten the flank and the lower back, and perhaps even the abdomen. The medial thigh comes in two flavors. One is a crescent thigh lift, and the other is a vertical thigh lift. The crescent thigh lift involves an incision in a crescent shape right in the fold, so the incision and scar is generally very well hidden. That's a really useful approach to men and women who have mild to moderate laxity of the skin. However, if there's significant laxity in the inner thigh, a crescent lift won't be able to give you enough pull to get the tissue from the middle of the thigh up, and we'll need to extend the incision down the inner thigh, which could be visible with legs open. And that's the disadvantage to the thigh lift when that component is added, but it's often necessary. With body lift and thigh lift, the recovery could be a few weeks. For one, it depends on how many procedures we're combining. Often, when you have skin laxity in one area, you have skin laxity in multiple areas, and thus, usually more than one procedure is being combined during that kind of operation. It's a surface operation, meaning we're not near any major muscles or under muscles or nerves and vessels, so the recovery could be pretty short, and I would tell patients that take it easy for a few weeks and probably not to hit the gym for at least 4 weeks. But the recovery is probably a little longer if we add the abdominoplasty and tighten the muscles. Body lifts, whether they include the belly or the flank or the thighs, will powerfully sculpt the body and restore what most will consider normal body appearance, where there isn't laxity that appears to hang from their legs or their arms. And so this is the kind of procedure that can transform a person because the results are so drastic, and is remarkable that how much these patients appreciate their new body after losing all of that weight. It's a very powerful operation.